If your child opens bowels for less than 3 times a week, that indicates that your child has got constipation, and that needs to be explored a little bit further. I'm Dr. Abraham Neduvamkunnil. I am a pediatrician working in Nottingham and Leicester. Today, we're going to talk about constipation in children. Constipation in children can be a cause of concern for many parents, but it is also a very common problem. And it is therefore very important to recognize early and use preventative measures and recognizing serious signs of constipation that become more challenging later on to manage. For it, you have to understand the important causes of constipation in children. This can be attributed to several factors. The first and the foremost, and which is a common one, is around the behavior and toilet anxiety in children. And this can come around the time of potty training or also the fear of using public toilets, where children then tend to hold on to their bowel movements. The other important causes are the dietary choices, and this means a lack of fiber in their diets and lack of fruits or vegetables or whole grains, and this can be a significant contribution to constipation. A fluid intake. I generally advise children that you need to drink water till your wee is like water. And the moment the wee turns yellow, it means we're not adequately hydrated. And this also plays an important role in helping the stools to be much more softer. And hydration is therefore extremely important. Rarely, significant medical conditions can lead to constipation, like thyroid problems, hypothyroidism, or an irritable bowel syndrome, or sometimes neurological disorders where the lack of bowel movements, this can also lead to constipation. Now, what is the impact of diet on constipation? Diet, as I said, is a pivotal in a child's digestive health. And to increase a rich fiber diet plan for your kids, it is important to ensure that you include high fiber foods, incorporate whole grains, legumes, fruits, and vegetables into the dietary meals. Once again, fluid comes as an important factor here, and also having regular meal times, encouraging the child consistent meal times to promote the regular bowel movements. Now, recognizing the important signs of constipation is really important here. And infrequent bowel movements. If your child opens bowels for less than 3 times a week, that indicates that your child has got constipation, and that needs to be explored a little bit further. The types of stools that the child passes, right from rapid droppings to gravy-like stools, it is important to understand where is the consistency of the stool. And this can sometimes lead to passing hard stools, which can cause pain and discomfort in the child. Occasionally, this can lead to fecal incontinence, or what we call a soiling or leakage between the bowel movements, and this can be another symptoms. And it is important to adopt fruitful measures like adequate hydration, physical activity, simple measures like giving prune juices. There are also some important things to understand to prevent significant complications of a long-standing constipation, which can become difficult in managing. This includes fecal impaction. Severe constipation may lead to hardened stools that may require medical intervention and a longer treatment. Sometimes children can strain and you can have rectal prolapse coming through the anus. While all these happens, young children, when they have soiling, it can have a psychological impact as well and cause unnecessary distress in the child. And it is therefore important to identify the triggers and seek medical intervention at the right time.